Bismillahirrahmanirrahim. Assalamu alaikum. In this lecture, we will discuss the management of dental patients with diabetes mellitus, focusing on both type 1 and type 2 diabetes. Type 1 diabetes is characterized by body's inability to produce enough insulin, often presenting in childhood. These conditions lead to various metabolic disturbances such as glycosuria and ketoacidosis, necessitating careful management of diet, exercise, and insulin therapy to prevent hypoglycemia. Type 2 diabetes usually starts in adulthood and is often associated with obesity. It involves a combination of insufficient insulin production and resistance to insulin effects. Management include lifestyle changes and oral medications with insulin therapy used only when other measures fail. For dental procedure, it is crucial to manage blood glucose levels to avoid hypoglycemia, which is more dangerous in the short term than hyperglycemia. Scheduling surgeries early and using techniques to reduce patient anxiety can help maintain stable glucose levels. Coordination with the patient's healthcare provider is essential for adjusting diabetes medications appropriately before surgery. Ensuring the patient follows a normal meal plan and medication regimen helps stabilize blood glucose levels during the procedure. This table shows types of insulin which are used for managing diabetes. Insulin therapy is primarily used in the management of both type 1 and type 2 diabetes. Patients with type 1 diabetes need lifelong insulin therapy due to insufficient insulin production, using a combination of fast-acting, intermediate-acting, and long-acting insulins to regulate blood sugar throughout the day. For type 2 diabetes, insulin therapy may be necessary if lifestyle changes and oral medications do not adequately control blood glucose. Patients might use fast-acting insulin for post-meal spikes and long-acting insulin for baseline control. So the selection of insulin types and regimens depends on individual patient needs, blood glucose patterns, lifestyles, and the type of diabetes. Monitoring the patient's vital signs and being alert to hypoglycemia symptoms during and after the surgery is critical. An electronic glucometer can help determine if glucose administration is needed to manage blood glucose levels effectively. Post-surgery patients should keep a close watch on their glucose levels and adjust insulin doses as necessary. In cases of severe hyperglycemia or infections, hospital admission may be required for optimal management. While well-controlled diabetic patients manage infections similarly to non-diabetics, poorly controlled diabetes can complicate infection management. Elective surgeries should be postponed until diabetes is under control, and prophylactic antibiotics may be necessary to prevent complications. This box outlines the key management steps for dental patients with both type 1 and type 2 diabetes, emphasizing the importance of well-controlled diabetes, careful scheduling, monitoring vital signs, and managing medications and infections are crucial for successful dental procedures. In conclusion, managing dental patients with diabetes require careful planning and coordination with healthcare providers. Understanding the differences between type 1 and type 2 diabetes is crucial for creating effective treatment plans. And monitoring and adjusting insulin and glucose levels along with managing infections is essential for patient safety and successful outcomes. Thank you. Wish you best of luck.